So now we're going to talk about the lymphatic system. So things first is with capillary beds, there are going to be lymphatic capillaries in the same area. Because remember when we talked about the capillaries, blood vessels, that it's not 100% effective in reabsorbing all of the fluid that's pushed out of the capillaries. So remember, hydrostatic pressure pushes fluid out of the capillaries and leaves the proteins. And then osmotic pressure, so the pressure and the pull of water to go inside with all these solutes, because remember, water wants to be where the solutes are. So there's a lot of solutes here because there's a lot of proteins. So water comes back in, but not 100% of the water that was pushed out based on the hydrostatic pressure is going to be pulled back in by the osmotic pressure, the blood colloid osmotic pressure. So that's where the lymphatic system comes in. So once interstitial fluid, which is the fluid that's pushed out of the capillaries before it goes into the cells, is going to be drained by this. Once it enters the lymphatic capillaries, it just switches to the term lymph. So outside the cells, surrounding the tissues, it's interstitial fluid. It drains into the lymphatic capillaries, it's lymph. And 2 to 4 liters of this fluid is circulated through your lymphatic system and then brought back to your blood, to your veins, to circulate your cardiovascular system. So it's about 2 to 4 liters per day. So again, 85% of blood capillaries are reabsorbing by the blood colloid osmotic pressure, but the other 15% has to be circulated or you'll cause swelling. So interstitial fluid and any kind of leaked plasma proteins, but those are smaller ones, not like albumin that's staying in the capillaries, to bring those back to the blood. So kind of particles, um, kind of everything that's pushed out and left in the interstitial fluid is going to be recirculated by the lymphatic system. The other part of the lymphatic system, there's 2 sections more. Another major part is immunity. So we're talking about the lymphatic system going along with the immune system because they're closely related. So when you're picking up that excess fluid that's pushed out of the blood capillaries, so we have white blood cells that circulate through our bloodstream. We've talked about the blood and the different types of white blood cells. Well, sometimes any foreign cells or abnormal chemicals can be pushed from the capillaries into the interstitial fluid. Then it's picked up by the lymphatic system. So it's another way that the white blood cells can monitor what's going on inside the body by actually going and being part of the lymphatic system as well. Because a major component of where white blood cells reside, so they are circulating through your bloodstream, so they are circulating in the blood. But remember, there was a small amount of blood, so we had kind of the layers of blood that we looked at. So it was the red blood cells, all of that, and then there was a tiny, teeny line of the buffy coat, which was the white blood cells, and then plasma was the non-cellular part, because a lot of times white blood cells are actually hanging out in other areas. So their one place is their lymph nodes. So immune cells or white blood cells are going to stay and guard and wait for something to circulate. So we'll talk about more lymph nodes in a little bit. So they're all sitting in a lymph node, and lymphatic tissue, this excess interstitial fluid that's entered, has to go through the lymph node and pass through those white blood cells before then it goes through again. So it's another way for white blood cells to make sure that they're coming in contact with a large amount of fluid so that they can protect against any foreign material. So also, once an immune response is started here, then it can kind of do chemical messengers and send out to the rest of the body and white blood cells to help saying that there's a certain infection inside the body. We'll talk more about lipid absorption when we get to the digestive system, but it is important. The lymphatic system is the only way that you're going to absorb dietary lipids, meaning fats that you've eaten. Because in the small intestine, they have to be absorbed by specialized capillaries that are going to be in the microvilli. Again, we'll learn more about this in the digestive system. So their capillaries are called lacteals. They open larger that the lipids can be circulated and brought into the blood that way. They can't be absorbed by the blood capillaries. And again, we'll go into um, greater detail with this. And since this is where fat that you eat is absorbed into your lymphatic system and then goes into your venous circulation, it also helps move fat soluble or lipid soluble vitamins, which are your A, D, E, and K. So, one component of lymphatic vessels that's different than capillaries is you don't really have a lymphatic bed. You have lymphatic capillaries, but they're one-way street. So, unlike the cardiovascular system where you kind of go out and then you go back in, lymphatic system is only one way towards the heart. So it's always going back towards the heart, no matter where it is. So you have larger lymphatic vessels that are moving towards the heart, which we'll talk about, and then lymphatic capillaries, which are closely again associated with blood capillaries. So, lymphatic capillaries, going over a couple of things with those. They are blind ended. So, again, they're different from blood capillaries that have an arterial side, the red side over here, and a venous side over here, where they're all interwoven and interconnected. That's untrue of lymphatic capillaries. They're blind ended, meaning they just have a dead end. So they just have one end and then they drain. And yes, this kind of looks more like capillary system, but a lot of these would be blind ended too, to be with that whatever capillary bed is down here. So lymphatic capillaries are almost in every tissue of the body. We don't find it in cartilage thing and the cornea. So both of those, so the cornea is that clear surface on the surface of the eye. So there are not blood vessels in your cornea, in a normal cornea. So as long as it's normal, it's the clear covering. So you have your cornea and then you have the pupil and your iris here. The cornea is the clear covering. It doesn't normally have blood vessels. So without blood vessels, you don't really need capillaries. Same with cartilage. Cartilage is avascular, meaning there's no blood vessels. No. So they get their nutrition in a different way from kind of diffusion from blood vessels nearby, but cartilage doesn't have it. Bone doesn't have lymphatic capillaries because a lot of times kind of there's not fluid exchange in the bone because it's hardened and mineralized. And bone marrow is going to be where the white blood cells are maturing anyways. So we don't really need capillaries and but lymphatic capillaries in there. There is blood capillaries. So some characteristics of lymphatic capillaries besides them being blind ended, meaning that they're just kind of one-way street, is they're very thin walled. So it's the same thing that we have with blood capillaries. Why are they thin walled? Well, they are absorbing as well. So we saw capillaries, blood capillaries are just kind of endothelial layer with a basement membrane, very, very thin walled because diffusion's occurring across them. So we want in blood capillaries moving in and out. In lymphatic capillaries, we want the same thing, thin walled. Granted, we don't want things moving out. We just want the blind ended and we want to be able to diffuse in. Faster diffusion happens when you have thinner walls. It's easier for things to diffuse across the small, kind of thin wall versus a thicker wall. It would take longer. They're also more permeable than blood capillaries. So it is important that they are able to, again, their point is to drain that interstitial fluid. So we want more things to be able to kind of clean up and go into these lymphatic capillaries. So they allow more to move through. So you can think of that allow more. And they can also take up larger molecules and pieces than blood capillaries. So we're going to see a characteristic of lymphatic capillaries in a sec of why that's true. So if there happens to be proteins lost or there's proteins in the interstitial fluid, smaller proteins, not all of them, then the lymphatic capillaries will be able to take them up. This also comes into play why um, in digestion, we can pick up dietary lipids because those are larger molecules that lymphatic capillaries can pick up and blood capillaries do not. Because even when, think of most of the blood capillaries are either a continuous wall or they have small fenestrations, not many sinusoids, which are the largest one, are going to be throughout the body. Most of them are going to be continuous or fenestrated. So, why do we have increased permeability, meaning we allow more in? So, first, the endothelial cells, so that inner lining, the same lining that we talked about with blood capillaries, the simple squamous kind of thin lining that we have, well, they actually in the lymphatic capillaries overlap. So what happens is they actually form kind of mini valves by that overlapping. So you can think of it just kind of roof shingles. They overlap like that. That makes up little mini valves. These mini valves you can see here are kind of held by collagen fibers in the extracellular matrix. All these are cells, and then the extracellular matrix is in between. So they anchor them there. What happens is with this overlapping is just makes the mini valve. So you can see right there and there. As you are producing more fluid, so if there's more fluid in the interstitial space, meaning in between the cells, well, then that's actually the fluid's going to pull on these collagen fibers that are kind of anchored here. So more fluid's going to put pressure on these fibers and pull them out. So more fluid opens these valves wider. Why does that make sense? Well, then we have more fluid buildup. Well, we want to drain more fluid. So opening these valves wider, more fluid can go into the capillaries. If you have less interstitial fluid, you have less pull on that collagen fibers, well, then they're going to be a little more closed. They'll still be open, but they're not as extensively open. Because if we have less interstitial fluid, we don't need as much drainage. And again, lacteals, we're going to talk more about when we get to the digestive system. That's going to be the specialized lymph capillaries that are in intestinal mucosa. So look at kind of the mini valves and being able to open wider, they're going to be able to absorb better the fat droplets. So that's why it's digested fat. And then they bring it into all lymphatic capillaries and all lymphatic vessels lead to the veins, subclavian veins specifically. I'll talk about that again later. So, lymphatic trunks are going to be kind of all roads are leading. Again, it's one-way street. So, we have lymphatic capillaries, and then they're going to go to collecting vessels, and then we're going to go into larger and larger vessels, lymphatic vessels, until we're getting towards, um, again, those subclavian veins. So we're not going to list all the names. I don't want you to memorize all of them, but they are named for where they're draining. There's actually 11 of them. So there's two lumbar, two bronchomediastinal, so chest, subclavian up under your clavicle, jugular in your neck, intercostal around your intercostal muscles, and there's one, meaning why it's 11 is one intestinal. So those kind of collecting vessels um, are going to all drain into two ducts. So these are the largest ones, is lymphatic ducts. So they are going to drain specific areas. So the right lymphatic duct drains the upper right arm, the right side of the head, and the right side of the thorax. So it's going to drain kind of. So the right thoracic duct is going to be the right side of the head. Going to be the right upper arm, kind of right arm there, and then the right side of the thorax. This is going to be this area. The thoracic duct is going to be everything else, the left side of the body. So the thoracic duct is significant. It's going to come up kind of chest as well, and it's going to drain again every other part, both legs, left arm, neck, left side of the head. And about 50% of people, the thoracic duct starts out kind of an enlarged sac. So it's kind of a enlarged bubble that comes in that's called the cisterna chyli. So not everyone has that bubble, but some of them do. So each is going to, so both the right lymphatic duct and the thoracic duct is going to both, again, go to venous circulation. So it's going to drain into a vein at the junction of the internal jugular. So internal jugular coming from the neck and the subclavian veins coming from the arm. So the right lymphatic duct is going to come in, and the thoracic duct is going to come in, and they are going to join venous circulation going back towards the heart, and then they'll circulate again through blood. So a better picture of looking at it. So this is showing you the thoracic duct. This is the cisterna chyli that we saw, or chyli, that some individuals have. And this is showing you the right lymphatic duct is here, draining into the subclavian, and the internal jugular is here. And then the thoracic duct is draining into this side. So thoracic duct comes up and kind of drains in. So you can see, again, a little closer up, the right lymphatic duct is here. The thoracic duct is going to be here. This is cisterna chyli if they have it, or if you have it. And then this is the thoracic duct coming up all the way, draining the rest of the body.